There's this woman that won't stop saying the hospital is the reason a 2-year-old boy cannot control his neck, sit, or even walk. A little backstory. So it happened that this woman delivered in the teaching hospital here, delivered a bouncing baby boy, but the boy was noticed to have jaundice. This woman was specifically told by the doctors that, okay, madam, your baby has jaundice and would need phototherapy. Phototherapy means the baby would need to be put under the light for the jaundice. So the woman agreed, started the phototherapy. No longer after that, the mother-in-law came and told her that the birth of the baby has to be celebrated and it cannot be done in the hospital. If it is jaundice, they can carry the baby to someone that would prepare purple leaf with glucose and all of that for the treatment of the jaundice. The phototherapy is not needed, and that way they will be able to save money. So the woman agreed and told the doctor to discharge her and her baby. The doctor tried to explain the complications of jaundice. When jaundice is very, very severe, it can affect your baby's brain. Please don't take this boy away. The woman said no, they have ways of treating jaundice in their area. Few days after that, they had to come back to the hospital. You know why? The jaundice did not get better. The eyes were yellow, the palms were yellow, skin was yellow, every part was yellow. That means at that point, the jaundice had already gotten to the brain. It had gotten worse. That's like the peak of the jaundice. At that point, because every part of his body was yellow, the only thing to do to save his life at that point was to do exchange blood transfusion. It means they will take out his blood and they will replace it with another blood. So they told the mother, bring a donor, we need a donor, so type of blood. We need to transfuse this boy immediately to save his life. So they did the transfusion, and to God be the glory, the boy survived it, was discharged home. But what the mother did not know was the jaundice had already gotten to the brain. The moment it gets to the brain, the patient will not be able to control his neck, he will not be able to walk, he will not be able to sit. It affects so many things. It could even affect the speech. It could affect swallowing. It could affect so many things. Because the boy was still a baby, all these symptoms will not be known to the parents. So they thought everything was okay, everything was fine. But at the point they expected the boy to sit, he could not sit. He could not achieve neck control. They felt okay. He just had a delayed growth. It was still going to get better. But my dear, it did not get better. The woman had to drop the boy with her own mother to take care of the boy. Because of all these deformities, they were not feeding the boy very well. So the boy came down with severe acute malnutrition. The boy had malnutrition. So that was why they brought the boy to the hospital. The first thing the woman said was, hospital is the reason her son cannot walk, cannot do this, cannot do that. We were trying to explain to her that, ma, the hospital is not the reason. It was because of the jaundice. She said no. The woman said it was the transfusion they did that affected the boy's brain. How no? How can transfusion affect brain? Even if transfusion will affect anything, you will see the reaction first before it gets to the brain. So it wasn't the transfusion. What you people don't know is there are two types of jaundice. First one is physiological jaundice, which can go on its own because it's as a result of the immaturity of the liver. The liver of the baby is not yet mature, and the liver is what gets rid of bilirubin that causes jaundice. You deliver the baby, as the baby spends days on earth, the liver gets matured and the liver is able to clear off the bilirubin. So that's the only reason your purple leaf, your glucose water would work. But there's another type of jaundice called pathological jaundice. This one is bad. It could be as a result of resource factor. Maybe the mother is negative, the baby is positive. The mother is O positive and the baby is B or A positive. This one also can cause jaundice, and some other things like that. Sepsis infection can cause jaundice, and some enzymes deficiency can cause jaundice. So there are so many other things that can cause this pathological jaundice. And when this happens, please take your child to the hospital. This is not the time to start taking your baby to someone that will prepare water, purple leaf, or someone that will start telling you to put your baby under the sun. The best place to take your baby to is the hospital, because the moment jaundice gets to the brain, what's the law?